Thank y'all very much, and Clark, thank you. I want to say thank you to Central Health. I'm going to talk a little bit more about Central Health here in just a few seconds, but the role Central Health is playing and with this white paper is critical and very important to what's going on in Austin and in Central Texas. But let me start off where Clark kind of ended in that introduction, and that is the concept of medical education in Central Texas. Everybody in this room knows that there's a lot of history with regard to a potential medical school and what all that could mean to our community. And we all know some of the background too, and we know that there's been a lot of really good work that has occurred over the past so many years. You can define it in a lot of different ways that has allowed, I mean, frankly, some of the projects that are part of it have been frankly extraordinary. But we've always had some issues too. Some of those issues have been political in my view. In some instances, it's been a lack of political will, if you will, to move forward on this because of fear of failure or fear that the better idea might come along, and what would happen if we start on something and then a good idea that we didn't think about pops up. All those kinds of things have actually slowed us from time to time. The other part about it has been that we haven't really had a plan. We've never taken the time as a community to sit down and look at all of the assets we have, all of the potential we have, and put it together as a plan. And I'm here to tell you, you already know it, but we need to say it every chance we get as we work on this thing that we want so much. It's going to be hard. It's going to be very complex. And there's going to be a pathway that is, there's going to be times where we're going to say, whoa, that didn't work out the way we wanted. There's going to be times when somebody says, ooh, that failed. Or there are going to be times when somebody has a better idea and we're going to need to figure out how we incorporate it. But in my opinion, now is the time. It's a little bit like we've tried to build a medical school, teaching hospital, health science center in Austin, Texas, and we've kind of tried to do it in secret. Like maybe if nobody catches us, we'll get it done. Well, now's the time to kind of put it out there, to move forward on it. What I did is I have visited with many people in this room. As I look around this room, a lot of you have been part of my discussions. And I laid out a proposal for 10 things in 10 years. And I think we can do all those. But for those of y'all that aren't familiar with the 10 things, let me talk about what they are. First, it's build a medical school. Now, the words medical school have kind of taken on a mystic quality a little bit. But a medical school and what we're talking about here in the community is really something more than a building, probably square, probably beige, with the words medical school written on the side of it. For sure, it means an education building. It means administrative offices. It means laboratories. It means some research facilities, those kinds of things. And we need that. But it also means a 4-year degree program. It means having joint degree programs. It probably means housing for students. It means all of the things that would make that medical school successful. Second is build a modern teaching hospital. Now, we talk about this in different ways, and we're going to have to figure out exactly how we do this. But a couple of things that you need to know. We have great assets throughout this community. As was just mentioned, we have St. David's, we have the Seton Healthcare family. We have, although it's Seton, what's the name now? Seton Family of Healthcare. I'll get that. I've got 10 years. I figure I've 10 and 10. By 10 years, I'll know how to refer to Seton there. But we've got all these great assets of the St. David's group. We have the Seton family, but what we don't have is we don't have modern teaching hospital rooms and facilities of that nature. And so we're going to need to look at that. We're going to need to look at how we go about teaching, what we're going to do with different assets that we currently have. I mean, BRAC is, even if you set aside a teaching hospital and medical school and all that, Brackenridge, to use a sad medical term, is maybe at an end-of-life stage. We need to be doing some things with Brackenridge no matter what. So it's time for us to maybe look at how we approach that. Number 3, and this is a key point that I want to underline because I'm going to come back to it as part of what we're here today to talk about, as a part of today. And that is establish modern, uniquely Austin health clinics. We can do so much for our current clients and so much more for them if we had a clinic system that fed into education, that fed into a medical school, that fed into a teaching hospital. We could do things in our clinics that are better in terms of specialty care. We could do better in terms of taking care of people with preventative care, the kinds of things that need to occur so that we have a healthier community. And that's all part and parcel of having, in my view, these 10 in 10. Number 4, develop a research institute and laboratories for public and private research. Number 5, launch a new commercialization incubator. Number 6, start a comprehensive cancer treatment center. And I see some of our friends from Livestrong here. Provide needed psychiatric care and facilities in this community. 8, improve basic infrastructure and create a sense of place. 9, bolster the medical examiner's office. And I always point out to folks that since I talk about what we ought to do to make people healthier and live longer, well, we'll talk about what we do with some of them when they're dead too. So the truth of the matter is Travis County is a key part of a 42 county area when we're dealing with the morgue. It's also a key part of education, not something that I actually knew when I started onto this journey, but we need to deal with that. And then number 10, of course, is solve the funding puzzle. What I've done is I've put together an organizing committee of experts and strong visionaries about where we can get. For example, with regard to Central Health, Dr. Coopwood and Rosie Mendoza both will represent Central Health on this organizing committee. We've already begun meetings, not all together as a committee yet. Our first meeting of everybody together as a committee will be in November, but we have started the process of different groups meeting together as we start putting together this plan. Let me briefly talk about what that means, in my view, for Central Health. Just a small part of that. I could give you a much longer version of the role Central Health plays. But Central Health, part of why we're here, of course, the reason we're here is the white paper. And that's a very important step. It is, in my view, a real sign of part of why Central Health is such an asset to our community. Many of you may be familiar with a report, a statewide report that was done just a few years ago that was called Code Red. And it talked about the needs of medical health care in our state and many of the ways of addressing that. This white paper is our version of Code Red, in my view. It helps define what our goals ought to be for much of our population in Central Texas. So Central Health is a key asset in our community. We know that it provides health care to those that can't afford it. We also know that it will be an asset that will be supporting medical education in a variety of ways, and it creates jobs for a variety of medical professions. The way I like to say it is Central Health has gone from startup to successful in a relatively short time. And I think it's important for our community to recognize how short a time that's really been. We shouldn't lose sight of the fact that it's been done that way. If you stop, I mean, we're Austin, right? So we like to think we've been at this a long time and we've always gotten it right. But here's the truth. If you stop and think just of our business community being defined as something other than University of Texas and state government, that's a relatively young business community, about 35 years, if you kind of do the math on it. Well, when you stop and look at how we compare to other major and large counties when it comes to providing the kind of help Central Health provides, we're even younger. We're even younger. It was just a few years ago, Jesus, it was the city of Austin. It was the city of Austin that was involved in this. Then we had the health district, but it's only been a few years. Other counties had counties and health districts well before us. So it's very important for us to never lose sight of how rapidly we have seen Central Health go from startup to successful. And that's something they deserve a lot of credit for. But what it does is it puts that success has put it in a position to work toward its very strongly held mission that everyone in Travis County be able to have access to health care, but do it looking at it from different angles. No longer is it the startup approach where you have to do it step by step a certain way, but now they can take a look from different angles and see if it can achieve those goals in a way that help even broader. It's matured rapidly at a time that health care is changing rapidly. And so it's ready to play a bigger role in our community, and one that expands the value proposition that maybe many of us thought we were just looking at when Central Health was originally created. And that really makes it a very critical partner in this effort to bring a medical school, teaching hospital, research institute, and all the other components that together create a health science center. And one of those components I just mentioned, and I said it and I'll say it again, modern, uniquely Austin, multi-specialty health clinics. I really believe that Austin and Travis County are primed for this effort because of the efforts of, when I look out at this room, so many of you in this room to develop the assets we already have in Austin. Now it's time to take it to the next level. With changes in the federal health care law, with changes in the delivery systems and payment models, health care 10 years from now will look very different than even it does today. We can and we need to have, we should have multi-specialty clinics in our community, in our neighborhoods. We can have health care in our homes, in some of our neighbors' homes, in a way that benefits the education of doctors and future doctors, but also benefits those patients and clients. We can have an emphasis, since we're doing this from the ground up, we can have an emphasis on prevention in ways that we've never been able to do and save real societal costs. At the same time, we are saving taxpayers money. And it all works together. By y'all being here at this really ridiculous hour in the morning, you've demonstrated something. But I'm an optimist. So what I'm going to believe you've demonstrated is a commitment to helping shape what it looks like and participate in our dialogue that all of this community is going to need to do, and in this, specifically this leadership dialogue, but in the greater dialogue of what we're going to need to do to pull this off. And I know you all look forward to hearing about all the different things that people will be talking about at the table discussions and the group visioning that's going to be done later this morning. Here's my challenge to you. My challenge to you is to imagine all of the possibilities for all aspects of our community. Improved health care, definitely, but also job opportunities for Austinites of all income levels, innovations and discoveries that save lives and spin off new companies, first-class diagnoses, treatments, and cures. I want you to imagine an improvement on our long-standing economic development model in this community, one that builds beautifully on our knowledge-based economy, but does it by focusing squarely on quality of life and the quality of living healthy lifestyles. It's time for us to go from incremental to transformational in this community. That's what this medical school initiative is about. That's what these 10 things in 10 years that we've put on the list is all about. But this is truly one situation where the sum of what we do is going to be much greater than all of the parts. And it's going to take the engagement of our entire community, not just your support, but your engagement throughout the process. We're going to need your ideas, we're going to need your innovations, and we're going to need your involvement. And we're going to need Central Health, which is now today teed up with this white paper, such an important step. We're going to need your support of Central Health as it moves forward to play the very dynamic role it must play in us achieving those 10 things in 10 years. I want to say thank you to everybody at Central Health that's been a part of this, but I want to say thank you especially to everybody in this room that's willing to play a role in what we're getting ready to do as a community. God bless you, and thank you very much.